My name is Dr. Johnson Wambugu. I am a dentist, or what they call dental surgeon. I have been in practice for the last 12 years. I worked in the public sector for a bit, then I worked in private sector, Mission Hospital for a bit, and then now I'm fully in private practice. Our clinic is called Bethany Dental Maxillofacial Center along Agwin Kothek Road. It's been here in existence for the last 13 years or so, and everyone is welcome to come. We see children, we see adults, people of all ages, basically family dentistry. When children are born, ideally they're born without teeth, okay? But the baby teeth are formed when the child is still in the mother's womb, okay? So in a normal situation, children are born without teeth. But sometimes we get calls from pediatricians when they deliver babies, and then a baby is born with teeth. So when a child is born with teeth, those are called natal teeth, okay? If a child is born and then within the 3 months, teeth now erupt, they grow in the mouth, those are called neonatal teeth. Now, natal teeth, the one that the baby is born with, many times we evaluate the child because they pose a risk to the child. They traumatize the child when the child is feeding. They traumatize the mother when the mother is breastfeeding. And the other thing is that sometimes they are not completely formed. They don't have a root. They're abnormal. So the child can inhale them. Okay? So what we do is that we assess, and many times we remove those teeth. Okay? And then the most common natal teeth are the ones on the bottom jaw. Okay? So we remove them. Those are called natal teeth, the teeth that the child is born with. Now, neonatal teeth are the ones that are formed a few months after birth, so maybe at 1 month or 2 months. And those ones we evaluate. If they are stable, many times we leave them. Sometimes we round them off to make sure that they're not very sharp so that they don't traumatize the child, and we let them be. Now, many children, okay, in a normal situation, they will get their first teeth at the age of 6 months, okay? And that some children are late bloomers, so that they can have the teeth form even as late as 9 months. But if your child does not get teeth by the time they're 12 months, now you should be worried, and that's when you need to visit your dentist to see what the problem could be. So the teeth that first commonly form, I'm going to use this model to explain the sequence of how they form. So at 6 months, the teeth that form first are the 2 lower incisors, the 2 mandibular incisors, okay? So at around 6 months, sometimes even 4, let's say 4 to 6 months, latest 9 months, the teeth should have come out, the two lower incisors. We call them mandibular incisors. Then the next teeth to form are the 2 upper ones here, the maxillary incisors, the upper teeth. Those ones form. Then at 9 months, the 2 next teeth here, we call them the lateral incisors, okay, form, and then they come out and grow into the mouth. Then the next 2 lateral incisors grow. That's around 9 months. Then, children do not have premolars, okay? So if you look at the teeth of a child, they have 20 teeth in total, as opposed to an adult who has 32. So children have 4 incisors on the lower side, 4 incisors on the upper side, 4 canines, that's in 2 up and 2 down, and then they have 8 molars. So they do not have premolars. Now the molars are the ones, when they are shed later, you get premolars. Okay, because there's a big misconception that I see people saying that my child is having cavities that are premolars. So children do not have premolars, they have molars. And the molars are shed, and then you get premolars, okay? And actually I saw this in a 844 textbook, and we had to talk to the teachers to correct that children do not have premolars. So where were we? At 9 months is when the incisors grow, okay? Then after 9 months, the next teeth that grow is at 12 months, which are the first molars, these ones that I'm pointing at, okay? And these months that I'm talking about, the time duration is not exact. It could be 12 months plus or minus some months. So it's not exact that 12 months is when they grow. It could be 12 months plus or minus, okay? So then the next teeth that form now is the canines. So the canines form at around 18 months, and then the last teeth that come out are the back molars, which is the second molar here, which come out at the age of 24 to 26 months. So by the time your child is 2 years and a few months, they have all their baby teeth. The baby teeth help this child grow. They'll help them with their speech. feeding. Okay, so they're important to keep these teeth. Now, parents will ask me, okay, if a child has a cavity on any of these baby teeth, why should you seek to have them treated? And the argument is, don't you think that the teeth will grow at will come out at some point? So what's the point of restoring the teeth? Now, the point is, these teeth hold space for the permanent teeth. If you lose a tooth early, the permanent teeth will, some drift, the baby teeth drift, and you actually end up with losing space for the permanent teeth. And so you end up with problems later. So it is important that to keep these teeth, keep them well, have them cleaned so they don't form cavities, and so they should be shed at the proper ages.